Hey everyone, and welcome back to the Product Builders Podcast. This is your host, Mark Garcia, and joining me on the show today is Anna O. Anna is a senior product designer at Teladoc Health, a world leader in whole person virtual healthcare. Anna, great having you on the show today. How's everything going?
Hi, Mark. Thank you for having me. Yeah, I'm very excited today.
I'm also very excited. We're going to be talking about product design and the designer's role within the healthcare industry vertical. Before we dive into things, I'd love to start off by having you introduce yourself and telling us a little bit more about you.
Sure. Yeah, I'm a senior product designer at Teladoc Health, and I'm originally from Seoul, South Korea. Moved to New York 5.5 years ago for my master's program, and then now I'm living and working in New York and building digital healthcare products. And I recently adopted a cat. I'm a pretty new to being a cat mom, and he's a super curious about all my virtual working meetings. So in case he might join us. My apologies if that happened, but hopefully he can take a nap during our recording session. But
No
yeah.
problem. We like having extra guests on the show. So I'm curious to know how you got into the healthcare space. I know when we first spoke, you had a really interesting backstory. Can you tell me a little bit about your journey from where you started to product design within healthcare?
Of course. Actually, this is my really favorite question because whenever I feel a little bit frustrated from work, when I respond to this question, it always reminds me of the moment that I fell in love in healthcare. How has this journey all begun? So yeah, I love to answer these questions. So when I was in Korea, I was art director at Samsung Global Marketing Group, which is called JL Worldwide. And my work revolved around advertising, marketing, and branding, and almost for 7 years. So it was a wonderful journey, especially working with brilliant, creative people in that industry. I really love that. But the thing is, it didn't really meet my personal goal as a designer because I really want to solve real problem and I wanted to see the impact on the end user from my design. But if you are working at marketing or advertising, you can definitely help your client and solve your client's problem. But it's hard to see how your campaign or your design can impact on people's daily life and how it can solve people's real problem. So I had a lot of side projects, which is a corporate social responsibility campaign, so that I can raise awareness of social issues. But it wasn't enough. It's not solving the real problems. And then later, I had a chance to join Samsung internal hackathon. And from there, I met Samsung Medical Center's ER doctors and engineers from Samsung Electronics. And we built really fun, smart IV pole using technology. And actually, that experience was the life changing moment, brought me to this space because one part, working with engineers was fascinating because it was my first time to see as a real time how my design can be coded and can be alive. When I handed over my design, developer wrote a code, all of a sudden it can be interactive, and then they're using microcontroller and then all of a sudden it can be like measure the weight and everything. So it was very fascinating. And then another part is we were able to see how this our concept can impact on our patients at Samsung Medical Center. We can really help their pain point. So these two factor really make me dopamine hit. So at the time, after this experience, actually made my design mission and ethic, which is I want to use my design skill set for building for good, especially for health, because health is one of the most important thing of our life. So that was the beginning of this journey. And then also that brought me to move to United States to study more about technology. And during my graduate school, I have three challenges. First one is language barrier. I'm still not very confident to speak in English. And the second one is learning programming. because I realized the engineers in Samsung, they spoiled me because they are the top engineers in Korea, and they looked like very easy, but it was not. So I thought I can learn programming within 2 years, but it wasn't really, it was very tough. So I really respect all engineers. And then the last part is navigating American healthcare system, because Korea, we do have universal healthcare, so it's relatively easy to navigating healthcare system. But during my graduate school, I learned out of pocket in network, out of network. Those are really complicated for me. So, and then it was a super huge learning curve. So that's why I found this is really great opportunity as I'm designer to building better healthcare system in here. And then so far, I've met tons of passionate people like doctors, investor, business people, or policymaker. Everyone really wants to build a better healthcare system. So I love this momentum with this passionate people. I think I'm very positive to we can build a better healthcare system. So yeah, that's why I'm super exciting to working in healthcare.
Awesome. Thank you for a very thorough intro, but fully agree. I think in product design, and maybe it comes with more experience or maybe just the person. I feel that making an impact with your work, whether it's in a social space or whatever you might be doing, is huge. It's purposeful. We want to see that our products, the things that we do, have real implications, and that we're not just designing for nobody. So I love that. I love how passionate you are. We're not going to touch the American healthcare system. There's a lot to go into there, but that leads me into my next question. Since the pandemic, and I feel like this topic is really relevant right now because of the pandemic and what we had to go through with like being remote and isolated and having to tap into virtual healthcare. I would say before the pandemic, I definitely did not do any sort of virtual healthcare. I didn't know it was a thing. Um, so my question for you is that I used the term earlier, whole person care, as part of my introduction. I know people are familiar with virtual healthcare, but can you speak about what whole person care entails and what does that phrase mean?
Yeah, of course. To understand who person care better, I will use some of the example that I read from one of the books. So let's go back to 100 years ago. At that time, we have a village doctor, and then he knows everything about you, your family, and local community. So he was the only one source of the truth to get care. So the good thing is he can provide personalized care, but a downside is he was not he, sorry, they, they were not specialists. So they were relying on their experience, not scientific evidence. Now, this modern medicine, it has been a lot of improvement, like with the biological and clinical research. So now we have a lot of specialists, and then clinical outcome became much better. But the thing is, navigating all these different specialists can be really complicated, can be disconnected, and then can be siloed. So whole person care concept is bringing this strengths from these two part, personalized experience like a village doctor did, and then special but also specialized experience so that we can increase better clinical outcome. And then now we do have a virtual platform, yeah, like you mentioned. By virtual using a virtual platform, we can provide much more accessible and affordable care. So, so that's why, especially in Teladoc Health, we are building virtual whole person care platform to make accessible, personalized, and then specialized care.
That's great. I love the analogy of like the village doctor to really understand that idea that at once the personalization was really there. And I feel like at a time it was lacking in maybe our healthcare system was it was not personalized. We weren't getting the healthcare that we should be getting. So that's great to hear. And so you talked about the virtual platform that you are creating. So in terms of the healthcare industry as a whole and technology, How is virtual and how is technology playing an impact in healthcare as a whole? Are you seeing any sort of trends in terms of people using it, and are people embracing virtual healthcare a lot more now?
Oh, yeah. Let's go back to whole person care. There is a three main services, which is primary care, so that you can have all your medical history with your primary care, and someone can give you referral. And then the second part is chronic condition management. Um, and then the third part is mental health. And then I see, especially this chronic condition management, mental health is really important to utilizing virtual healthcare platform. Chronic condition management, like 60% of adults in United States lives with chronic disease. And then diabetes is the country's seventh cause of the death. And then diabetes is the most expensive treatment. So if we can use a virtual healthcare platform, especially treat this diabetes or chronic disease, you can do self-monitoring, and then you can work with virtual coach whenever you are and then wherever you are. So it can lower the treatment cost, and then also it can increase healthcare outcome. And then if you have chronic disease, likely you could have mental health challenges, because treating chronic disease is very stressful, and then it's very painful. So mental health and the chronic condition have commodity, but mental health never had a perfect supply and then demand, because always we are lack of mental health provider, and it's really hard to navigate to find the right mental health provider. So through a virtual platform, you can find a better and accessible mental health care platform and then find a mental health provider. And if you don't have chronic disease, everyone has some level of anxiety in this modern society. And then um, learning about managing stress is really important. It's also really impact on your physical health. I went to a health conference yesterday, actually, and then one of the mental health provider, she mentioned that one of the research said our teenagers, they identified mental health as the biggest challenge, make them anxiety even more than gun violence or climate changes. So everyone getting to know about importance of mental health, and then having virtual care allow us more accessible mental health care. So that's why I think it's super important to have virtual platform for this whole person care system.
That's great. And at the start of the pandemic, one of the first podcast episodes I did was with a healthcare platform that helped users find in network therapists. I know mental health was a big issue during the pandemic. And so I thought what they were doing was great because one, healthcare is expensive. So there's that. And then two, being able to connect people with licensed physicians and doctors and whatnot is huge. And so I thought what they were doing was great. And as well, hearing that technology plays such an important role in our healthcare is really interesting to hear. So that brings me to my next question. I know we're here to talk about product design, not necessarily all of healthcare, which we could probably spend a full hour talking about. I'd love to hear more of your thoughts on the role of like product and tech in um, in a person's healthcare. So you mentioned earlier things that technology can enable are like self monitoring. I also think there's things like encouraging healthy behaviors through technology. How does design and technology, in your mind, play a role in all of us helping maintain a better, healthy lifestyle?
Yeah, it's a good question. So I will more anchor to whole person care and then designer's role. I think three main important part designers as a player a really important role for building whole person care. The first one is making navigation much easier to this whole person care journey. Like I mentioned, whole person care contains a lot of different services. So it can be complex, especially in digital space. So designers can help our users how to navigate, how to check their follow-up from the primary care doctors, and how they can check their referral. So make experience navigating much easier. It's one of the really important designer's job. And the second part is, like you mentioned, bringing engagement. Um, for example, if you have diabetes, you need to check regularly your blood sugar, and then you need to regulate your food intake, and you need to motivate exercise and get better sleep. It's a lot. And then as we are human, it's really hard to keep motivating by ourselves. So designers can focusing on understand people who have diabetes, their lifestyle, what they need, their challenge, so that we can create the product experience much engaging, much fun, so that people can more frequently check their blood sugar. And if they can check frequently and then regulate their food intake, it will impact on their health outcomes, such as lowering their blood sugar. So this engagement can impact on clinical outcome. And if this clinical outcome ultimately can impact on business growth. So I often think designer as a translator between our users and clinical team and business. So finding sweet spot by bringing engagement is the one of the biggest role for the designers in digital healthcare space. And then last one that I really want to emphasize is building accessible design, especially in digital space. Um, Maybe many of us heard about 1 out of every 12 men is color blind. So let's say we are designing health status using color green as a in range, using red as out of range. But if we are using only color, if you have color blind, you can really notice which one is out of range, which one is in range. So we need to make sure we have text label, we implement right screen reader, and we assess all the accessibility to make accessible healthcare. So that's really important designer role, especially in digital space. So I'm really working closely with our expert on accessibility. So one of the big part of the design review is including accessibility review with their team. So we check whether I have right screen reader, whether I have a right tab order for someone using keyboard. So that's really important part as a designer role. So
Those are all fantastic points to bring up as a designer. And I think even though we're talking about healthcare, that really translates to a lot of other industries when you're doing product design, accessibility, a huge one, navigation, particularly for topics that are complicated. Healthcare is can be hard to understand sometimes. And so I've found the most successful online platforms are the ones that make it really usable, talk to the user in a very layman's way where we can understand the language. And so those are great points. One additional question I had is regarding personalization. So within all product design right now, I think personalization is a big trend. People will want to see the content and have products be personalized to their preferences, algorithms, using their data, etc. And this ties back to you mentioned, that doctor village being able to personalize their healthcare. Are there ways that healthcare platforms um, are creating more personalized experiences on their technology? Are we looking at data a lot and providing more personalized care recommendations? Can you speak to what personalization looks like within like a digital platform?
yeah, that's a good question. And also personalization is actually impact on better health clinical outcome. Um, well, I'd like to talk about one terminology, which is called Medicine 3.0. If you are a big fan of Dr. Peter Attia, you might know what I'm going to talk about it. So if you want to learn more about personalization healthcare and Medicine 3.0, I highly recommend to read his book, which is called Outlive. So let's go back to Village Doctor. At that era, we called Medicine 1.0, which is generalist daycare treatment based on their experience, not evidence based. Medical 2.0 is now we're starting to use evidence based clinical treatment based on clinical trial and the scientific research. And then in this era, finally, we are using electronic healthcare records and using some digital tools such as virtual telemedicine services. And now Medicine 3.0, this is something that we can make super hyper personalized care by utilizing advanced technologies such as AI. These days, everyone loves about AI, right? AI, definitely. And then big data and the wearable devices so that we can see everyone's biomarkers and then also genomics. Everything can provide super hyper personalized care experience based on everyone's individual's demographic, their medical history, and their condition and their lifestyle. So and this medical 3.0 ultimately can impact on longevity and expand our lifespan because the benefit of super hyper personalized care, we can prevent disease. So far, our care experience is reactive care, meaning when you have symptom, then you go to doctor's office. And a few of my doctor's friend, yeah, they said during their medical school education, they learned how to treat, how to medicate people, but they didn't learn how to prevent disease, how to guide patients to prevent disease. By the way, if you're a professor in medical school and then if you teach preventive care, I'm sorry about that. I'm not generalized. Just talking about few of example from my friends. So what we really need to focusing on is prevent disease even before we have symptom. And this hyper personalized tools and digital technology can help us to this preventive care.
We talked about this when we were playing the show, preventative care being able to um, a switch, right? We were talking about reactive care as our normal method of what we're used to. And I think to even some basic things like I've used ZocDoc in the past, and it sends me a reminder once a year that, hey, your appointment was a year ago. You should book again. And I think to myself, before we had technology, you kind of just had to remember, I think I went to the doctor last year. Maybe it's time to go this year. So I love how you talked about technology enabling preventative care. You already gave some examples. I'm not sure if there's any more to add there. Otherwise, I can move on to my next question.
Yeah. So I'd like to talk about why I excited about this evolution of medicine because hyper personalized care, meaning human need to be center. So that's designer's job, like make human focused. When we build a product, we often forget about human and then end up we are too much focusing on growth hacking, A/B testing, revenue. That's super important, but always we need to build a product for human. And then especially for this hyper personalized care, definitely we need to anchor always people and the users. So I'm super excited about this hyper personalized care opportunity that will open much more role for designers. And then one thing that I'm excited about in this preventive care, there is a four really important factor, which is activity, sleep, stress management, and food intake. All these four factors really needs a lot for us. So, for example, Medicine 2.0, we were the passenger on our ship, and then our providers, doctors, they were the captain who control our ship to navigating our health journey. But to get the preventive care, hyper personalized care, we and then our doctors, we both need to be a captain to control our ship. So, meaning designers also need to understand what this users really needs and then what providers needs. So, again, translator, what's the sweet spot? This two captain, so that we can design our ship the best, the way for the individual's preference. So yeah, just wanted to make sure that the designers' roles are getting much bigger. And then I'm excited about a partnership with more clinical astrology team and then doctors and um, physicians.
One of the things that you said that really stuck out to me was don't forget about the human. And I've had so many conversations across so many products, and everyone always says it can be really easy to get focused on the process of product design and all of the different things that go into it and forget about having empathy, forgetting about who you're actually designing for in the end. And when we talk about healthcare, we are literally talking about the human body. It's funny to see how these concepts translate across different verticals. They're the same and yet they're very different. And that's always good to know. Just don't forget about the human in your product design. Wanted to get into one more term that came up as we were planning behavioral science. I know that plays a part in the work you do, both for strategy as well as in your design thinking. Can you talk a little bit about behavioral science and how that plays a role in your product design?
Sure. Yeah, we talk about hyper personalized care, meaning it requires a lot for individual for us. So, meaning we need to understand to humans' behavior so that we can um, make much seamless experience, even though we are asking a lot for the users. So, understanding behavior science really help us to immediate change behavior for the users or help users forming their behavior in a long term. For example, um, um, current Teladoc's chronic condition management, which we used to call this program named Livongo, and then maybe 4 years ago, Livongo had a study with a third-party vendor. So we are using one of the behavior science principle, which is called framing effect. So meaning we people perceive same information differently when we depends on how it presented. So Livongo, there is a email outreach, and then originally we have, hey, join your let me see, it was, oh, join Livongo for diabetes today. That was existing one. And then using this framing effect, we changed the copywriting into claim your Livongo welcome kit today. So same information but just framing differently. But the result was the new condition, the new idea. It increased email open rate by 25% and then click through rate by 88%. So it can show how using a behavior science principle can really impact on immediate users' behavior change. This is one part. And then for chronic condition or mental health, it's really important to building healthy habit like checking your blood sugar, get more exercise, get better sleep. All these things we really need to understand how humans action intention gap it will be looks like. So what's the right intervention to get motivate them to check more blood sugar better more often and then get more motivate to their exercise. So I see there's a tons of benefit and opportunity to using this behavior science principle into design thinking process so that we can provide better experience for our member, and then it can ultimately increasing a better clinical outcome. So I'm not an expert of behavior science, but I'm very passionate about learning and then advocating behavior science. So one of the things that I was working on, I was co-hosting this behavior science learning sessions with our behavior scientists so that our stakeholders can learn behavior science together. And then we can find some opportunity how this principle can actually apply to our real problem and then impact on our members' experience. So I'm looking forward to building a behavior design framework with collaborating with our behavior scientists and then our researchers so that our stakeholder can use this framework as a toolkit to create some intervention or creating design solution.
That's really interesting to me. I love the framing effect that you mentioned in terms of perception can be achieved differently based on how things like contextual presentations of things, right? And I think back to when I first got into UX and people asked, what does that mean? People didn't know the term, they didn't know what it meant. And when you think about it, product design and UX is really there's a bit of psychology to it, right? You're partly assuming how people will want to use something and how they're going to navigate an app. But part of our jobs as designers is also seeing how they use it, seeing how they think. Are they using a thing how we intended it, or are they completely doing something different? And why are they doing that? So hearing about like psychology and design as part of our roles, really interesting. I wish I could dive into it more myself. There's so much I'm sure we could both learn in terms of product design and behavioral science frameworks, etc. So thank you for touching on that. We could probably spend a whole episode just talking about that alone.
I love to.
So I know we are coming up on some time here and we've thrown out a lot of big words here, but I am going to start bringing this conversation to a close. You have had a really interesting career journey, very different from my own. I'm curious to know maybe what are some of the most important lessons you've learned over your career that you can share with our audience that would be relevant for them as well?
Yeah. So most of my work had need to work with massive cross-functional collaboration, a cross-functional team. Even when I was in Samsung as an art director, to launch campaign, you need a lot of staff and a team. Launching on campaign is not a you can do by yourself, right? And then even in technology side, I'm day to day. I'm working with developers, product managers, researcher, behavior scientists, content strategists, a lot. So I think collaboration is really important. What I really learned so far is collaboration can be happen only based on respect each other's role. So I think collaboration is not a smoothie, it's salad. Meaning in salad, you have a green, you have a protein, you have a dressing, you have a nuts. So it has their own role. And then when it comes to together, you have some texture and then you have taste. We are not really put all the ingredient into the mixer and then grinding it and then drink it, right? So sometimes we can misunderstood collaboration. You can do everything. You can control everything. But it's really important to respect each other's role and then constructively receive and sharing feedback each other's and then create the synergy. So that's really important. So, but often I've observed some people can really overstep, like to control everything, but that's not a collaboration, right? So I think respectfulness is really key for collaboration. And then to get there, I think also is really important to way of communicating your feedback. So for example, as I'm a designer, I had a lot of design reviews and some feedback can be, oh, this is confusing, but that's not a feedback. That's just you are talking out loud. You need to consider your audience, and then you need to really consider benefit of your what you're talking about for them, for the audience. So the right feedback can be, I think XYZ can make confusion for users. So how might we try XYZ? Kind of like proposing some quick idea and then why you think it's confusing. So that's, I think, the right way of feedback. But in our day to day life, it's very hectic and busy. So I understand people can just spit it out what they think. But in feedback section, I think it's really important to sharing right way of communicating feedback. And then that's also increase better collaboration spirit. So that's what I learned.
The collaboration is a salad, not a smoothie. First time I have ever heard that analogy, but I love it. And I was actually unsure of where you're going there. I'm like, what does that mean? But it makes so much sense when you explain it, as we are all individuals as part of a whole. And collaboration is working together versus um, the alternative of just kind of throwing everything in at once and hoping it works. So love that. I'm going to use that with my team. That was fantastic. Part of our conversation today, I know we threw a lot of kind of big words out there, big ideas. Are there any thought leaders in the space that you could recommend? Any resources that our audience can go to if they want to just learn a little bit more about some of these ideas?
Oh, sure. Like I mentioned, I'm a big fan of Dr. Peter Attia since I'm very passionate about hyper personalized care. So if you haven't read about his book Outlive, it's one of my recommendation. And then the second book I recently read, which was really helpful, especially for designing healthcare. The book title is Designing for Health, the Human-Centered Approach. And then the author name is Craig Joseph and Jerome Pagani. I really enjoy this book and it's kind of fun. I really like their writing style. So I recommend this book. And then the last one is it's a newsletter and community. It's called Design with Care, and then the owner is Alex Blistane. I think this is the best resource that you can get healthcare related UX trends. And every first week he send a newsletter, and then you can see all the latest healthcare UX trends. And also now he's trying to build a community so that designers in healthcare that we can share more information, and then we can play more important role, and then partner with business and then clinical team. And I'm also I'm also working with him to grow this community better. So I highly recommend to subscribe this newsletter. You will get tons of really insightful healthcare UX related resources.
Thank you for those. We will, of course, link those out as part of the episode. So I know we spoke about a lot, Anna. We like to wrap up our conversations with what we call our Majestyk bite, which is a key takeaway that we would want our audience to walk away from. Can you share what your Majestyk bite would be for this episode?
Yeah, I think I'd like to say responsibility, humanity is the key for product building. Like you mentioned, what like we discussed, we often forget about human, but the reason that we are building product is for human, right? And then we need to take responsibility what we are building for. It's not about number of like, not about subscription number, or not about A/B testing or growth hack. Those are super important, but before these things, human need to be first. And then as I'm a designer, always I'm trying to anchor human focus when I work with our stakeholders. So responsibility, humanity is, I think this is the key for when we building a product.
That is a great bite. Also, I love the bites that everyone shares. They are really refreshing and also remind me as a product designer what I should be focusing on and reminding me of why I got into the field in the first place. But Anna, it was so great having you on the show today. I'm sure we could do a follow up to kind of talk into more of these topics we brought up today. But thank you so much for your time today. And it was great having you.
Thank you so much.